Thank you very much. And I'm very happy to be here to give some remarks and a quick overview of workforce and HRSA's investments in work and how we're really tackling some of the issues that you all have already you've already kind of alluded to. So with that being said, we can, move on to the slide presentation and you can go to the first slide. And I just, also want to congratulate everyone on, doing this work and wish you all the best as you move forward with this project, with creating this next generation of the health workforce. So basically, some, just kind of things that I'm sure you all are very familiar with in terms of the health workforce, and that is there is growing demand for the health workforce, a shrinking supply, and some of that is due to COVID. As well as there's an unequal distribution, and that has been an issue for some time. We know that healthcare is a major economic factor in our country, a major economic driver and labor market, and employment in this sector will grow by 14%. It's projected to grow by 14% by 2028. And this is much faster than some, other sectors and other occupations. It's estimated about 1.9 million new jobs. And so there's a lot of, of demand in the field and a lot of growth. And I think COVID, we all know COVID-19 really has sort of exacerbated the situation. But here we are, and we're going to move forward with creating that next generation to supply the care that we all need. Next slide, please. So as we look at the data around the pandemic's impact on the health workforce, it's starting to trickle in, and we're starting to get a picture of the impact. Even though it's not all there yet, we have some reporting that is going to occur, later this year in the summer and so forth, and some of the databases are going to be, refreshed, and new data will be coming in. But there's some things that we do know, and that some trends that we already see in play. And so we did see quite an increase in injury and illness in terms of the healthcare and social assistances. We saw that. And so we saw a lot of respiratory illness, and we saw certain professions really sort of or occupations in healthcare even bear the brunt of that, with a lot of nursing assistants, a lot of direct care workers and the like, a lot of nurses, seeing respiratory illness. And we've already seen that some of the healthcare sites have already reported losing some of their workforce. For instance, the health centers are reporting losing anywhere from 5 to 25% of their workforce in the last 6 months, with 15% reporting losing 25 to 50% of nurses. And so we know that the pandemic has really had some implications for the health workforce. Next slide, please. So this really, I think, drives home the importance of the work that, we do in terms of workforce development, in terms of HRSA's investments in the Bureau of Health Workforce. We really our mission is really to improve the health of underserved populations by strengthening that workforce and connecting that workforce to communities that are in need. And so when we look at the constellation of our programs, we really span the whole pathway of workforce development, from the education and training, which we call the pipeline, all the way into service, which is actually providing care and providing services in the community. Next slide, please. And I think we somehow got mixed up on our slides. So if you can go back one slide, I'm sorry. Yes, thank you. So if we look at our programs, we have 4 key areas where we aim to BHW programs, over 40 plus programs that we have. Our budget is around $1.8 billion. And then we've had quite a few plus ups with CARES Act and ARPA, American Rescue Plan dollars. but really, we really target our programs in 4 specific areas. The first is access. And so that's our big, whenever we're looking at our strategic plans, whenever we're looking at our programs, we're thinking in terms of how can our programs increase access to medical services. And so it sort of becomes, access becomes sort of, I guess, the culmination of some of these other buckets in which we really target our funding, which is on increasing the supply. And that's where we look at expanding the numbers and, increasing the numbers through expansion programs. So some of our programs really target for increasing like class size or increasing the numbers of certain health professionals and paraprofessionals. And then some of our programs are really, especially like our direct service programs like National Health Service Corps and Nurse Corps, and others really look at the distribution. Where are those professionals and paraprofessionals working, and what kind of levers like scholarship and loan repayment can we provide as incentive for those individuals to work in rural and underserved communities. And then the other arm is quality, and that's where we really look to influence things like curriculum, content, the diversity of the health workforce and things like that. Those things that we know affect the quality of care that is provided. Next slide, please. So as we, look to really, impact the care that happens in communities all across the nation, we are really focusing in 3 key areas. And those key 3 areas are behavioral health, community health, and maternal health. So those are the sort of like the big priority areas that we're focused on. And they certainly feed into some of the government-wide priorities around health equity and COVID-19 response. And then, we have some cross-cutting themes that are across all of our programs, which are things like provider resilience, telehealth, and certainly diversity and health equity within all of our program offerings in our portfolio. And so these all align to support the administration's priorities. Next slide, please. So how do we achieve this? Basically we look at all of the levers that we have. How can we support things like recruitment from the communities that we want to serve? So, we kind of in this mindset of how can we best, sort of grow your own. We want to train students in the communities where we want to see them practice. We want to support that community-based training by really strengthening the academic community based partnerships. And that's a running theme throughout our programs, as well as we want to leverage our loan and scholarship programs where we can, because we know that there's good evidence that those individuals, once they're in those communities, they stay. There's a very good retention story there for the direct service programs. And then we want to make sure that, we're promoting value and quality. And so we want folks to train in interprofessional collaborative teams. And so, we really are thinking about being patient-centered and making sure that that collaboration happens. And then certainly increasing access also to behavioral health and oral health through the integration of those with into primary care. Next slide, please. So as we look at our program areas, this is just a snapshot of, some of our outputs and some of the, just the numbers of individuals that we have training in academic, that we had training in academic 2020 and 2021. And you can see our priorities really play out there. We had record numbers in our loan and scholarship programs, and that's the Nurse Corps again, and some of the new programs that we've had as well around SUD, substance use disorder programs that are targeting that. And we had some carve outs in those programs for behavioral health, as well as for some of the IHS, the Indian Health Service, and tribal entities. And so you'll see there just some of the numbers there of how many we're training, how many individuals are actually serving, and in specific areas. So for instance, in geriatrics and in pediatrics, how many participants we had in our program. Next slide, please. So this next slide is really just a snapshot of showing, you know, where we're training. So really, as I've said, we really are focused on training in community-based because there's evidence to show that individuals who train in those environments will stay there, and when they finish, and they will practice. And so in our programs where we can, we require actually some of those programs to actually take place in rural and underserved communities. Otherwise, we encourage. And we try to include that in some of our review criteria and things like that to really make sure our programs are honing in. And this is just a snapshot to show you that we've pretty much been holding steady in terms of trying to make sure that our trainees are actually getting experience with, you know, in underserved communities, in primary care, and in rural communities. Next slide, please. So this is just a snapshot of our teaching health center model in which we've had quite a bit of investment recently to grow that program. And so, for instance, from 2019 to 2023, there's going to be an investment of $288 million in Medicaid and Medicare savings due to these programs. And, you know, these are happening, these trainings, these postgraduate medical education training is happening, you know, predominantly in FQHCs and lookalikes through our THC-GME program, which is really what we intend to do. And we've had 23 million so far invested in fiscal year 2022 for planning and development, so to spur new programs and to really improve primary care training. And certainly we know that individuals who train in these types of, you know, non-acute settings tend to go back and practice in those settings. And so there's a good retention rate as well. And so that's really a big part of this program, is really a big part of our effort to improve and to increase access to primary care services in those rural and underserved communities. And then this is just a snapshot to show you where some of the funding is in the states, in your states, and where the THC-GME presence is. Oh, I'm sorry, I meant to say next slide. That's where the THC-GME presence is in the states that where you all are focused on. And then next slide, please. So this again is a snapshot of some of our programs, our nurse core and our NHSC programs, and showing you where the individuals are retained, so that they're retained in these areas after they practice. So we've got an 84% retention. And when we say retain, meaning after their service is completed, they stay. And these are the rates at which they stay in the HRSA and health profession shortage areas, as well as in communities, in a community primary care setting. So it's well over 80% in all of these metrics. Next slide, please. And so this is just a snapshot of our field strength for NHSC and Nurse Corps in your 4 states, where you can get the totals there of individuals who are serving and what their post-service retention rate is. Next slide, please. And so we had this year, as you all may know, we invested about $103 million in resiliency training. And so that's just a snapshot of the dollars for those programs. We also stood up a technical assistance that will be providing information to the field around resilience best practices. And these are for systems-based changes, as well as for individual sites to provide training to students and safety safety providers as well. But really the emphasis here is a systems-based, evidence-based approach to tackling resilience. So you have resilient sites and resilient systems that can support providers. Next slide, please. And again, that is just another snapshot of the dollars that we provided for resiliency training. Next slide. In your state. And then this is current funding opportunities. So we have 2 funding opportunities right now. Those are for public health to support COVID recovery, but also to support public health infrastructure. And so one is a $39 million investment in public health scholarships, and that is open till June 1st. The other is a $226.5 million investment to expand community health workers and other community health trainers, doulas, promotoras. So it runs the whole gamut. So it's not confined just to community health workers, but those providers and supporters that are embedded in the community. And so we expect to make 75 awards in that one. Next slide, please. This is just a snapshot of some of our publicly available health workforce data that you all are free to delve into and to use to help you as you plan your activities and to develop your workforce. And I would really say we've really made an effort to make more of this data publicly available. And so that's just the sources there where you can go in and get that information. And then, you know, I guess the last, this is my last slide, and, you know, just really talking about how we really are trying to key in and to address, you know, community needs better. And so, you know, all of the community-based training, the expansion in that area, as well as the tools and the metrics, all of these things, we really are trying to make sure that we do everything in our programs to be focused on and target communities. So we recognize that the communities are our customer. I mean, that's where we want to make the change and we want to make the improvements. And so with that, I'll end and I will take any questions. Thank you for your attention.